Welcome to the last chapter of this course, which is about some application on radioisotopes in nuclear medicine for therapy. So I would like to show you only two examples for therapy in nuclear medicine. Here you can see a list of some isotopes which may be used for therapy. You have strontium, yttrium, samarium, dysprosium, holmium, and iodine isotopes. The common for these isotopes, they all are beta emitters. You may remember that when a beta emission occurs, then the beta particles can destroy the surrounding tissue in a distance of a few millimeters. And that's the purpose. That's what we want in such a situation. You see, if the bone tumor may be treated, arthritis may be treated, a liver tumor may be treated. And the example I would like to emphasize is the thyroid treatment. So once a patient has hyperthyroidism, then that means that actually an overfunctioning of the thyroid, and it means it grows too high. So then iodine 131 treatment is the best. Earlier, a medical doctor, actually a surgeon, used the surgery treatment, so they cut off a part of the thyroid, but it's always a big question which part to cut off. So the best thing is if the doctor uses iodine, radioactive iodine, and then the whole mass of the thyroid is homogeneously killed in a certain percent, depending on the dose the doctor sets. So the isotope which is used is iodine 131. And why iodine? Because the thyroid contains the thyronin hormone, which is an iodine containing hormone, and it has a precursor which is a tyrosine, an iodinated tyrosine. And this chemical information is needed how to reach that the thyroid will take up the iodine. So this is a result question already, of course. And thyroid is in general is always ready to absorb iodine, and that gives a very good option for this medical treatment. You see, the half-life of this iodine isotope is pretty long. So once somebody has this treatment, then he or she is asked that not to go to parties, not to have a very close contact with other people, because this is true that for a while this patient acts as a radioactive source. However, you can trust the doctors that even for the patient himself or herself, this dose is so limited that the positive effect on the health, so the benefit for the health, is much higher than the risk the patient takes because of the increase in the risk of the cancer sometimes in the future in his or her life. So this is a safe procedure to treat hyperthyroidism. This is the last and probably the most sophisticated examples of application of a radioisotope in nuclear medicine. You see, this is again therapy, and it's a successful treatment of a severe prostate tumor metastasis case. When there are metastases, that is a very dangerous situation. Then that is a very serious disease. What did they do, the doctors? You see, this is a molecule, a pretty complicated molecule. You may remember that if I want to carry an isotope to the tumor cell, I need two sections for the molecule. One is that finds the tumor. So this is a tumor finder. This part of this molecule is the tumor finder. So this is very specific. This molecule section is very specific to a prostate tumor cell receptor. So that makes it possible an extremely precise targeting of the tumor cell. That is why these doctors could take the risk to carry an alpha emitter with this radioisotope carrier molecule section to the tumor cell. So they used actinium-225. This is an alpha emitter. You may remember that the alpha particles are 20 times more dangerous than beta particles. So if you use alpha particles, you have to be very familiar with the situation, and you should be very confident about the safety of this procedure. This study was published in a scientific paper, and I would just like to show you that what they could achieve. So this was the first situation, an image of the patient body. You see, this is a terrible image. So a very severe metastasis case of prostate tumor. So the patient got some actinium activity, okay, carried by this molecule. So here was the actinium at this point, the actinium isotope, okay, and then it was repeated 3 times, and you see already when the second time it was he or she was treated, I don't know, then there were much less level of tumor cells. So this was a fantastic treatment. So the alpha particles here emitted by the actinium-225 successfully killed the prostate tumor cells. There was a third treatment here, and now comes an interesting case. You know, an actinium isotope is an alpha emitter. However, alpha decay is always accompanied by gamma transitions. So an alpha emitter is normally also a gamma emitter. So this imaging was achieved by the gamma radiation of the actinium-225. So treatment, therapy, and diagnosis was also performed in the same time. Later, of course, the doctors didn't want to apply more actinium. They didn't want to destroy more cancer cells, tumor cells, because this was already a more or less clear case. But they wanted to indicate only the presence of tumor cells if there are any. So they didn't want to kill anything, but they wanted to see an image of the patient's body. So they turned to gallium-67. And gallium-67 has an electron capture decay, so there is no particle emission. This is solely good for diagnostic purpose only. So in this situation, the same molecule was used. So this molecule part found the tumor cell, if there is any. And here was, instead of actinium-225, a gallium-67 isotope purely for diagnostic purpose. And this is how these images could be produced. And you see, I think this is a fantastic result, because whenever a metastasis is observed for a patient, then the chance for surviving is very low. So this is I think this is a fantastic result of the medical doctors. So I hope I could convince you for this whole course that the otherwise very dangerous radiation, the very dangerous ionizing radiation, can really be turned to serve our health. And with this, with the proper method and with the proper hand, with expert doctors, these radioisotopes can be used to cure you and to help improving your health in many ways. Thank you very much for your attention.